Greetings and welcome to Wally's Nursing Videos. Today, we're delving into the complexities of schizophrenia, a condition characterized by a myriad of symptoms affecting thoughts, perceptions, emotions, movements, and behavior. These symptoms fall into two main categories: positive and negative. Positive symptoms, often referred to as hard symptoms, include experiences such as delusions, where individuals firmly believe in false ideas despite evidence to the contrary, and hallucinations where they perceive things that aren't actually there. On the other hand, negative symptoms, categorized as soft symptoms, encompass aspects like a flat affect, where emotional expressions are notably lacking, a lack of volition leading to a diminished drive or initiative, and inattention, making it difficult to maintain focus. Typically, schizophrenia emerges in late adolescence or early adulthood, with peak onset occurring between 15 to 25 years for men and slightly later between 25 to 35 years for women. Despite its relatively low prevalence, estimated at about 1% of the total population, its impact is substantial. In the United States alone, nearly 3 million individuals have been, are currently, or will be affected by this disease. Schizoaffective disorder presents an even more complex picture, as it involves a severe combination of psychotic symptoms and mood disturbances. In these cases, clients face significant challenges due to the interplay between these two domains of symptoms, highlighting the critical need for comprehensive and individualized treatment approaches to address their unique needs effectively. Continuing our exploration, let's delve into the clinical course of schizophrenia. The onset of this disorder can be abrupt or insidious, with most individuals experiencing a slow and gradual development of signs and symptoms. Diagnosis typically occurs when the actively positive symptoms of psychosis, such as delusions and hallucinations, are more prominent. In the immediate term course of schizophrenia, two primary patterns are observed. Firstly, some individuals experience ongoing psychosis, never fully recovering from their symptoms. Alternatively, others may go through episodes of psychotic symptoms followed by periods of relatively complete recovery. Looking at the long-term course, we often see a diminishing intensity of psychosis with age. As individuals age, the disease becomes less disruptive, and many may find themselves able to live independently later in life. However, it's important to note that despite this, many individuals with schizophrenia may still encounter difficulties functioning within their communities. Now let's touch upon some related disorders. Schizophreniform disorder shares similarities with schizophrenia, but has a shorter duration, typically lasting between 1 to 6 months. Catatonia involves a range of motor disturbances, such as immobility or excessive movement, often associated with schizophrenia. Delusional disorder is characterized by persistent delusions without other psychotic symptoms. Brief psychotic disorder presents with sudden onset psychotic symptoms lasting less than a month. Shared psychotic disorder involves delusions that develop in individuals who are closely associated with someone else who already has a psychotic disorder. Schizotypal personality disorder involves odd behaviors, beliefs, and interpersonal difficulties, but to a lesser extent than schizophrenia. As for the etiology of schizophrenia, various biologic theories have been proposed. Genetic factors play a significant role, with a polygenic risk implicated in its development. Neuroanatomic and neurochemical factors are also involved, including abnormalities in brain tissue, cerebrospinal fluid, and dysregulation of neurotransmitters such as dopamine and serotonin. Immunovirologic factors such as viral exposure and cytokine imbalances have also been implicated. Researchers have even explored potential origins of the disorder linked to infections in pregnant women, particularly following influenza epidemics or respiratory ailments. These factors collectively contribute to our understanding of the multifaceted nature of schizophrenia and its complex origins. Now, let's delve into the critical realm of cultural considerations when understanding schizophrenia. What might be considered delusional thinking in one culture could be entirely acceptable or even revered in another. For instance, auditory or visual hallucinations are sometimes viewed as a normal part of religious or spiritual experiences in certain cultures, contrasting sharply with the pathologizing lens through which they're often viewed in Western contexts. This brings us to the concept of culture-bound syndromes, which are specific clusters of symptoms that are recognized and named within particular cultural groups. Examples include buffet delirante in French-speaking regions, ghost sickness among certain Native American tribes, jikoshu kyofu in Japan, locura in Latin American cultures, qigong psychotic reaction in China, and Zar in North Africa and the Middle East. Understanding these syndromes is crucial for providing culturally sensitive care and avoiding misinterpretations of symptoms. Moreover, there are notable ethnic differences in how individuals respond to psychotropic medications used to treat schizophrenia. Factors such as genetic variations in drug metabolism, cultural attitudes towards medication, and differing healthcare systems all play a role in shaping these responses. Recognizing and respecting these cultural nuances is essential for providing effective and equitable care to individuals from diverse backgrounds. Let's now explore the realm of psychopharmacology treatment for schizophrenia, which plays a pivotal role in managing the symptoms of this complex disorder. Conventional antipsychotics primarily target positive signs of schizophrenia by acting as dopamine antagonists. However, they often show no observable effect on negative signs. In contrast, second-generation antipsychotics, which act as both dopamine and serotonin antagonists, not only diminish positive symptoms but also have the potential to lessen negative symptoms, offering a more comprehensive approach to treatment. When it comes to maintenance therapy, 6 antipsychotics are available in depot injection form, including fluphenazine, haloperidol, risperidone, paliperidone, olanzapine, and aripiprazole. Transitioning to depot injections may be considered after achieving stable dosing levels through oral therapy, typically taking several weeks. It is also important to know the potential side effects associated with antipsychotic medications used in the treatment of schizophrenia. Neurologic side effects are common and include extrapyramidal symptoms like acute dystonic reactions causing involuntary muscle contractions, akathisia characterized by an intense urge to move, Parkinsonism leading to tremors and rigidity, and tardive dyskinesia resulting in repetitive involuntary movements, particularly of the face and tongue. Other neurologic concerns may include seizures and the rare but serious neuroleptic malignant syndrome. Additionally, non-neurologic side effects such as weight gain, sedation, and photosensitivity can occur, along with anticholinergic symptoms like dry mouth, blurred vision, constipation, and urinary retention. Orthostatic hypotension, causing a drop in blood pressure upon standing, is also a potential concern. Understanding and managing these side effects are crucial aspects of providing comprehensive care to individuals undergoing pharmacological treatment for schizophrenia. Let's delve further into the review of antipsychotic drugs and their associated side effects, along with pertinent nursing considerations. Antipsychotic drugs are divided into 3 generations: conventional or first generation, G, chlorpromazine, fluphenazine, thioridazine, haloperidol, loxapine; atypical or second generation, e.g. clozapine, risperidone, olanzapine; and third generation, dopamine system stabilizers, e.g. aripiprazole. These medications are primarily used to alleviate the symptoms of psychosis by blocking dopamine receptors in the brain. Now let's discuss some of the side effects commonly associated with antipsychotic medications and relevant nursing considerations. Extrapyramidal symptoms, EPSs, are a group of movement disorders that can arise from antipsychotic use. These include acute dystonia, which manifests as involuntary muscle contractions leading to symptoms such as torticollis, neck twisting; opisthotonus, spasms causing backward arching of the head, neck, and spine; and oculogeric crisis, uncontrollable rolling back of the eyes. Nursing interventions may involve administering anticholinergic drugs or diphenhydramine to alleviate these symptoms. Pseudo-Parkinsonism, characterized by symptoms resembling Parkinson's disease such as stooped posture, mask-like faces, and a shuffling gait, is another potential side effect. Nurses should monitor patients for these symptoms and collaborate with the healthcare team to adjust medication as needed. Akathisia, marked by restlessness, anxiety, and agitation, can also occur. It's essential for nurses to recognize these symptoms and provide supportive care to alleviate discomfort, which may include reassurance and relaxation techniques. Neuroleptic malignant syndrome (NMS) is a rare but potentially life-threatening side effect characterized by fever, altered mental status, muscle rigidity, and autonomic dysfunction. Nurses must promptly recognize and report any signs of NMS for immediate intervention and monitoring. Tardive dyskinesia, a permanent condition involving involuntary movements, is another concerning side effect. Nurses should monitor patients for any signs of tardive dyskinesia and collaborate with the healthcare team to adjust medication regimens accordingly. Anticholinergic side effects such as dry mouth, constipation, and urinary hesitancy or retention are common with antipsychotic use. Nurses can provide supportive measures such as oral hygiene and bowel management to mitigate these symptoms. Additionally, other side effects may include increased prolactin levels, weight gain, most likely with second-generation agents, metabolic syndrome, cardiovascular adverse effects, QT interval prolongation associated with certain medications, and agranulocytosis, specifically with clozapine. Nurses should monitor patients closely for these side effects and collaborate with the healthcare team to address any concerns promptly. Let's now discuss important client teaching points regarding antipsychotic medications and delve into psychosocial treatments commonly utilized in managing schizophrenia. When educating clients about antipsychotic medications, adherence to the prescribed regimen is crucial for achieving optimal outcomes. Clients should be informed about the importance of taking their medications as prescribed and the potential consequences of missing doses. It's essential to discuss strategies for managing common side effects, such as thirst, dry mouth, recommendation of sugar-free candy and increased fluid intake, constipation, emphasis on dietary fiber and regular exercise, and sleepiness/drowsiness, advice on safety measures such as avoiding driving or operating machinery when feeling excessively sleepy. Clients should also be educated on what to do in the event of a missed dose, with a general guideline of taking the missed dose if it's within 4 hours of the usual administration time. In addition to pharmacological interventions, psychosocial treatments play a crucial role in supporting individuals with schizophrenia. These treatments often involve a combination of individual and group therapy sessions, focusing on various aspects such as medication management, the use of community supports, social skills training to improve interpersonal interactions, and cognitive adaptation training to address cognitive deficits commonly observed in schizophrenia. Cognitive enhancement therapy, CET, is another valuable intervention aimed at improving cognitive functioning and overall quality of life. Lastly, involving family members in education and therapy sessions can provide essential support and improve treatment outcomes by enhancing understanding and communication within the family unit. These comprehensive psychosocial interventions aim to address the multifaceted challenges of schizophrenia and promote long-term recovery and stability for individuals affected by the disorder. Let's now apply the nursing process to the care of individuals with schizophrenia, focusing on assessment, data analysis, nursing diagnoses, outcome identification, interventions, and evaluation. During the assessment phase, gathering comprehensive information is crucial. This includes obtaining a detailed history, such as the age at onset of symptoms, any previous suicide attempts, current support systems, and the individual's perception of their situation. Observations of the client's general appearance, motor behavior, and speech are also essential. They may present as odd and exhibit psychomotor retardation, use word salad or echolalia, or demonstrate latency of response. Assessing mood and affect for flatness and blunting, as well as anhedonia, is essential. Furthermore, evaluating thought processes and content for abnormalities such as thought blocking, broadcasting, withdrawal, or insertion, and identifying delusions and hallucinations across various sensory modalities are critical. Judging the client's judgment, insight, self-concept, roles, and relationships, as well as physiological and self-care considerations, including hygiene, grooming, and recognition of sensations, are also crucial aspects of the assessment. Moving to data analysis and nursing diagnoses, potential nursing diagnoses may include risk for other-directed violence, risk for suicide, disturbed thought processes, disturbed sensory perception, disturbed personal identity, and impaired verbal communication. These diagnoses guide the development of outcomes, which may include focusing on safety, contact with reality, interaction with others, expression of thoughts and feelings, and adherence to interventions. In the intervention phase, safety of the client and others takes precedence, followed by establishing a therapeutic relationship and using therapeutic communication techniques. Interventions for addressing delusional thoughts and hallucinations, coping with socially inappropriate behavior, providing client and family education, Promoting self-care, nutrition, social skills, and medication management are also implemented. Finally, during the evaluation phase, the effectiveness of interventions is assessed. This involves monitoring the client's progress toward meeting the identified outcomes and adjusting interventions as necessary to optimize care and promote recovery. By applying the nursing process systematically, nurses can provide comprehensive and individualized care to individuals with schizophrenia, fostering their well-being and promoting their journey towards recovery. Let's discuss considerations specific to the elderly population with schizophrenia and explore community-based care options, mental health promotion strategies, and self-awareness issues for nurses working with these individuals. Elder considerations in schizophrenia encompass various aspects. Late onset, typically occurring after age 45, is less common but not unheard of. Psychotic symptoms emerging later in life are often associated with depression or dementia rather than schizophrenia. The long-term outcomes for elderly individuals with schizophrenia vary widely, with approximately 1/4 experiencing dementia, leading to a steady decline in health, while another quarter may see a reduction in positive symptoms. The remainder often remain relatively unchanged in their symptomatology. Community-based care plays a vital role in supporting elderly individuals with schizophrenia. Options include housing with family or independently, participation in assertive community treatment programs, receiving behavioral home health care, accessing community support programs, and utilizing case management services to coordinate care and access resources. In terms of mental health promotion, it's essential for nurses to maintain self-awareness regarding their reactions and responses to clients with schizophrenia. Recognizing that suspicious or paranoid behavior is a manifestation of the illness rather than a personal attack is crucial. Nurses may experience fear or discomfort when faced with challenging behaviors, and it's important to acknowledge these feelings while ensuring safety measures are in place. Additionally, nurses should refrain from taking the client's successes or failures personally and instead focus on the progress made, such as the amount of time spent out of the hospital. Visualizing the client's improvement and recovery can also foster a positive therapeutic relationship and outlook. By understanding these unique considerations and implementing appropriate care strategies, nurses can effectively support elderly individuals with schizophrenia in the community while promoting their mental health and well-being.